Hi nurses. In today's video, we are going to talk about 5 moments of hand hygiene. Hand hygiene is one of the safety component which is assessed under a domain of safety according to NMBA standards. So it's really critical that you understand where to apply these 5 moments of hand hygiene. So let's go through each of them, and then I will tie it back to how you will perform in an OSCE station. So first, 5 moments of hand hygiene is a universal concept, and it is defined by World Health Organization, and that it is a critical component to prevent infection. So first moment of hand hygiene before touching a patient. So when you approach the patient and before you touch their hand, touch their body part, that's when you will perform hand hygiene, moment 1. Moment 2 is before a procedure. So some of the examples are taking vital signs, doing a blood glucose level check. So that's when you will perform moment 2. Moment 3 is after a procedure or body fluid exposure. For example, your patient vomited, you discarded the vomit bag into a waste bin. So that's when you got in touch with body fluid. So you will be performing moment 3. 4 is after touching a patient. So if you have generally, after touching the patient, or when you introduced or handshake, or for whatever reason, that's when you will be performing moment 4. Last one is after touching patient's surroundings. So if you have adjusted patient's bedside table or adjusted their sheets, or you came in contact with their bed, that's when you will perform moment 5 of hand hygiene. So for example, you are going to be part of a scenario which is like checking patients' vital signs. So when you enter the room, that's when you will perform first hand hygiene moment. And secondly, when you start doing the procedure and you hold your patient's arm to do a blood pressure, so that's when you will do hand hygiene moment 2. Then after you complete the procedure, you're done with your patient's checking blood pressure, vital signs, you will perform moment 3. And same is moment 4. Actually, moment 3 is when you are actually doing an invasive procedure or you came into body fluid exposure. That's when you will be doing 3. And then after you finish your procedure, you are leaving patient's surroundings, but you adjusted patient's bedside table. That's when the moment 5 comes in place. So these hand hygiene moments are assessed in every station. So it's important that you perform this skill consistently at each station, because that will matter during your exam when your final marks come in, that you have consistently demonstrated adherence to 5 moments of hand hygiene, and that will make you successful in the safety domain of the OSCE exams. Stay tuned in. I will go through actually how to perform 7 steps of hand hygiene whenever you perform these moments. So in my next video, we will be going through that. So stay tuned and keep following us on social media. Thank you.